know, people keep thinking that they, you know, they do things, they think is I don't know why favor and this other guy is not on, because I've just watched that they are just discussing. All right. Okay. All right. So um so at the end of the day, this the patient died, and they held them responsible. They're in prison as we talk. They're in prison. So most times people think they do them. Think they are doing you, but at the end of the day, it will come out. I always say something to come out. So that's why we're taking all these precautions. Okay. So only extinguish fire if it's safe to do that. Yeah. Leave the building immediately. I mean, walk quickly, but don't run. Yeah. Fire characteristics and spread. So flame height, fire intensity, uh, season, frequency, flame angle, flame depth. Okay, so those are smoke, and like I said, the smoke kills more even before. Uh, so yeah, that is for fire. Okay, so we're going to go to the HAI. HAI. Do we know what H is actually called ACAI, to be honest? Yeah, because it's healthcare acquired infection. Okay, so these are infections that you can actually get while you are in the health sector, where you are there with them. You are in the hospital. You know, you can easily get something from there. So, we remember when there was COVID, a lot of a lot of nurses died from the COVID year, especially um, the foreign, I would say those from ethnic minority group. The COVID really killed our people. Good nurses killed a lot of top nurses that, you know, before you become a top nurse, you have to sacrifice. In fact, you will be down to earth that people will march on you and all that. But I mean, what other people will not do, they will enter and do it. If you don't do it, you can't. That is the thing. It's not a lay back way they lay back in Nigeria. No, you don't lay back. If you are in the emergency, there are some units you'll be in the hospital here. You cannot sit down. You are standing all day. It's not by sitting down, you sit down and just be relaxing. No, 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 no. You are working all day, like standing 24 hours. Some people are dead, 12 hours standing. I'm looking at them like this. You people are very courageous. So that is especially the general nurses, okay? And sometimes it carries on to other nurses as well. So it's not is what you give, you get. All right. So that's just about it. And the this infection is in Europe. It has killed more than 90,000 people. You know, due to, according to research, yeah, hospital patients are um, they are prone to the bacterial infection. So they are compromised, their immune system. And we Africans, we are compromised a lot. Yeah, we are compromised because we do a lot, and also we don't know how to take care of ourselves. Yeah. So when you shake people, you touch people, like you do some wound dressing, you do some carry out some surgical or clinical operations or clinical duties, and then you don't wash your hands. I mean, that was what I was talking about. So we have the MRSA, yeah, we have that. We have different, I mean, we talked about COVID, yeah, we talked about the other ones that there are other different bacteria that can come in place. So we have to be mindful of all this. There are antimicrobial resistance organisms. So the microorganisms that develop this um, antimicrobial resistance. So they develop it, and then they are called super bugs. They are known as super bugs. Yeah. So they have that resistance. So even if you are taking some medication, it doesn't even touch them. Doesn't touch them at all. So um, well, they get to mastermind your system. Some of them, they live inside of us, and then they they kind of understand our system, our body. So they build up and become harmful to us. So there are many of them like that, but some of them are harmless, like you know. Okay, but yeah, sometimes when some people, that is why they've been talking about these antibiotics, that people should stop taking antibiotics, because sometimes you take antibiotics, then you become, it's like your body is even the antibiotics. So any infection, the antibiotics will not work again for the body. All right. So we have sepsis. We know about sepsis. It's life-threatening. So we can go and study about it. There are many stages of sepsis. So which are three in, they put it in three stages. So we have the sepsis, that's stage one. We have severe sepsis, that's stage two. And we have septic shock, that's the stage three. All right. So we try as much as possible, when we get it at point one, we try um, to stop it there, so that it doesn't become another problem. All right. We stop it. We make sure we work on it, rectify it, and uh, um, put a heart to it at that point. So, I mean, yeah. So the infection, how the bacteria enter the body and all that. If you read more about sepsis, it will tell you about how it comes and all that. I don't want to go through that now, but you can always study about it. So we have chain of infection, yeah. So we have the first, we have the agents, yeah, infectious agents. So it could even be the carrier, of this agent, yeah, the carrier of the infection, rather. So when you have that, then there's what we call the reservoir. All right. So where is that infection stored? Yeah, where is it stored? So where you say reservoir, so maybe that door handle that you are using. Eh? So so they have the port porthole of exit. Yeah, then we have mode of transmission. All right. Then portal of entry, and we have the host. That is uh, the host. Yeah. So those are the chain of infection. Okay. Risk assessment. Will come back to risk assessment. So you need to go back. I mean, risk assessment for this infection, we have to look at it again, because everything we do risk assessment. So don't forget about the face mask. If you deem that you need it, and face mask will help you, you have to use it correctly. Follow the policies and procedure for all this, and then you'll be able to use that. Wash the things immediately you finish work. Make sure you wash your clothes. Wash it above 60 degree, yeah. Wash your clothes, and make sure all this are sorted. So decontamination. So we normally have this system where we can um, decont uh, do the decontamination in a machine, right? But some, I don't know why in Nigeria, but we can also use the washing machine and use a high temperature to sterilize, disinfect, and clean products, clean our either our clothes, the clients, help them when we go to their homes, and even when we are doing some massage, we'll be able to uh, wash all these things because people will be coming in and out. So you need to wash them. So that's that one. So waste, make sure you dispose of the waste, make sure you take the waste away. Now we're going to talk about information governance. Yeah, information governance. So if we're looking at information governance, many will not understand what it is. We just say, okay, information, oh, what is that? So this actually helps to support the provision of high quality care. Yeah, it encourages responsible staff to work closely together, yeah, to develop supports, arrangements, and provide staff with appropriate tool and support. So to enable organizations to understand their own performance and manage improvements. Principles of information security. So when you have information, right, there are some information of the organization now. You are not allowed to use it. That is why I always talk about your personal phone should not be used for work. You need to put your personal phone, when you go to work, put your personal phone in your bag and go and keep it. I mean, there are places you work here. You will not see your phone until when you close from work because there's a place where you have to store your phone. There's a place you store your phone, and you will not see your phone again until later. So um, you must be able um, to store information safely, whether on the laptop or any gadget or any form of device that you need to store. You have to have a PIN code to store each information uh, of either for the company or for our clients. All right, and you have to do it so that it does not become um, a means where other people can um, go in and then get information that they are not supposed to get. So the principles are applied through three cornerstones. Information must be secured against unauthorized access, confidentiality, confidentiality. Information must be safeguarded against unauthorized modification, integrity. Information must be accessible to authorized users at all times when they required it. Availability. So all this comprises of information governance. Yeah. So you don't allow people to just come and use the company's information and then they are not, you don't make it available for them because they don't have access to it. So duty of conduct. Duty of conduct, people tend to ignore it at most times, especially nurses. So when we look at it, you say voluntary of all relevant information in persons who have or may have been harmed by the provision of services, whether or not the information has been requested or whether or not a complaint or a report about that provision has been made, right? So that is a report from Francis 2013. So what triggers duty of conduct? What triggers the death of a patient when due to treatment received or not received? When there's a problem, they will come up with, there's so many things that come up and say this was supposed to be done. Why is this not done? So you will see all laws. Everybody, family of the person will come out. The government will come out. So many things will come out. Remember What happened to Mohbad? You remember what happened to Mohbad? If we remember in Nigeria, even though it's in Nigeria, the nurse that says she's a nurse, meanwhile, she's not a qualified nurse, that gave that injection. She's in prison. All right, she's in prison because she gave that injection. All right, so this is what it, that is why I always, some of them, um, hold on. So that is why I always tell people when they come up, some of them will say, I'm a nurse. I told them, you are a nurse from where? Are you qualified? They say, no, you are not qualified. So why are you calling yourself a nurse? You are not a nurse. Okay. So don't take things that, because you put yourself in trouble with that. So the triggers to duty of conduct can be severe. There can be severe harm. So in essence of permanent serious injury as a result of care provided. So there might be serious harm that can be done uh, to the person, yeah, and there can be moderate harm. So there's no permanent, but there's psychological effect from whatever happened. So we can report this. I mean, you can be polite, professional, and listen, apologize to the, if there has been a mistake, and then provide a time frame for resolution, correct service failure as soon as possible, check client satisfaction. So you can always go to the client and apologize, tell them you are sorry, and then change whatever it is, that you've done that is not right, because you know what it's saying. They're always saying clients are always right, isn't it? Sharing information when things go wrong. Yeah. So when things go wrong, you can always talk with the appropriate professional. Talk with those that are are supposed to, and you talk with the right people, and not some people, they keep talk when it's time to talk. They'll just be on their phone, they'll be talking about other things that are not relevant. So we don't want that situation. We don't want the culture of things like that. We want to follow the proper way. All right. So proper way of handling our clients, so that they will be happy, and it is when they're happy, they will recommend another person. All right. So yeah, the fraud act, there's a fraud act. So fraud by false representation, fraud by failing to disclose information, fraud by abuse of position. All right. So if you abuse any position, there are so many. That's where they brought up the counter fraud strategy. So there's a policy that is been set for that. So you can also read the Caldecott report. Caldecott report is a very good one. There are many policies, acts. There are many acts that is in place to deal with this data protection, deal with a lot of um, areas where we are talking about information governance, where information are kept properly. They are not just thrown on the air like that. So there are many. So we have the Data Protection Act 1998. You can go and read it. There are 8 principles. Go and read it. General Data Protection Regulations, GDPR, which is most used for in website and all the internet usage. Freedom of Information Act 2000, and I know Nigeria has a website or internet online what's it called, act as well to protect people. Confidentiality, right? Confidentiality. So you must keep things confidential. I don't want to go there and talk about it. Yeah. So you need to study about that confidentiality and disclosure. What can be disclosed? What should not be disclosed? When somebody calls you on the phone, what can you say and what shouldn't be said? When you patients are there, what can you tell them and what should not be said? So when you are with a client, what can you say and what you should not be saying? And when you are two staff are there, you are together, yeah, what is it that you can tell? What is it that you can say and speak on when you are there? You, for example, you are taking care of a client. Yeah, you are taking care of a client at home, and two nurses or two staff. You are taking care of the client, and all you do there is just talk on top of the head of the client. You know, you are talking on top of the head of the client. You know, the client is sitting down, and you are giving them informations that they don't need. Instead of you talking to the client to care for the client, you are not doing that. What you are doing is talking about maybe you went to a party, things like that. You start doing it's not allowed. Yeah. So there are personal data breaches. So a breach in security leading to the accidental or unlawful destruction, loss, and alteration, unauthorized disclosure of an or access to personal data. This includes accidental and deliberate breach. So when you are in the office now, you are working, you are using the company's either the phone or the laptop or the computer, whatever, or even the documents there. You are using it to gather your own personal information, to use it for your own personal use. Is fraud. There's an act for it. That is a prison term. No, there's not. No, it's prison. And there are ways you can, when you are using gadgets that is official gadgets, yeah, and you are not disclosing it, you are saying, oh, I'm not using it and all that. And with this is found out that you've been using it, is prison straight up. All right, is prison. So it shouldn't be. So your email should be safe. Learn how to keep your professional email safe. You shouldn't be using it with anyone. It should be kept safe. Social media should be safe. Social media should be safe. Patients' records. You should keep patients' record very safe. Put it in a very, there's codes to all of them. Let it be very safe. So now we've finished that area. So we're going to talk about conflict resolution. What is conflict resolution to us? Yeah, what is conflict resolution to us? All right. So because of time, I'll just quickly, because of time, yeah. So conflict resolution and what is conflict? Conflict is something that it is a normal thing that happens. It's normal and unavoidable. You cannot avoid it when interacting with others, especially when you are from different backgrounds. So, and it can happen for many reasons, various reasons. So, misunderstanding, miscommunication, or lack of information. All right. Difference in values, competition, relationship breakdown. Yeah. You can have relationship breakdown. Challenging behaviors can cause it. There are so many things that can cause conflict resolution. All right. Um, so we can all look at different areas and look within ourselves that, oh, where do we really go wrong sometimes? What sometimes some people will do something and you just have to um, you have to just rub it on you, like, that never happened. Because I always tell people, you can't change adults. You cannot change adults, but you can always try to sort things out with them. All right. So, violence and protection. So, how do you tackle violence? How do you protect staff? So, many organizations, they look for ways. They put um, they put policies and procedures in place to help tackle violence. And mind you, we at Moricol we have zero tolerance for tolerance for any violence or aggression. So we want people to work together to grow. We don't tolerate conflicts. Yeah, there are better ways to handle situations. Okay, stages of conflict. So, Favor, can you mute yourself? I did say it from the beginning. Potential opposition or incompatibility. So if the people are not compatible, there'll be problems. Communication, structure, personal variables. So there are always misunderstanding, yeah. So which is obviously oppositions, difference in opinions. Cognition and personalization. So those are another second stage of conflict. So intentions, those are the third stage. So behavior, fourth, and outcome. Yeah. So if conflict is not, there's no resolution, it can cause a problem. Okay, it can cause problems. So we in a workplace, the approach is, how do you handle conflict in workplace? Yeah. So you can accommodate, like I just said, you can accommodate the person and just pretend as it never happened. Avoidance, collaboration, so compromising, competition. So stages of recognition, serious and aggravated resistance. So non-compliance, verbal resistance. So you can also have conflicts with the client as well when they are not happy with what you do. So you have to look for a neutral ground on how to resolve issues with them. Reducing the risk of conflict. So so obviously physical measure. That is why we have the CCTV, access control, alarms, pager, radios, mobiles. So you can use all this when you are in someone's home, when you're caring for them, or they come to the office. Some clients can be very aggressive, although we have zero tolerance for that. So lone walking. So lone walking has to do with when you are walking away from the hospitals, away from care homes, supported living. So you are walking outside of the office now. So you are walking, going to the patient's home, going to certain locations. So always carry a fully charged mobile phone. Think ahead. Try to find safe locations to meet. Park in a well lit area. So if you are driving, make sure you park your car in an area where people can see you and they can identify you. So let colleague know where you are, when you arrive, leave, and expected to return. You remember I said something like that when I was talking just now, that you can call when you are in front of the place. You can call, I'm going in, and when you are coming out, I'm coming out. I'm out of the place, so they know where you are. All right. So even though we will do checks, we're doing a lot of checks for everyone actually. So challenging behavior. Challenging behavior can be, you have a lot of clients that will need your support. Even if you have the elderly that have dementia, they will not even know what they are doing because the dementia is already affecting their cognition. So they will not be able to respond. They will not be able to respond like you will expect them to respond. So there, they will be violent. Sometimes they will think you want to attack them, depending on how you come across. So you might be mindful of that, yeah? And challenging behavior and conflict often happen due to distress or needs not being met. So you can have people with autism. Yeah, you can have people with autism. You can have people with a lot of issues. Yeah, a lot of disorders that some of them are diagnosed, some of them are not diagnosed. So there you need to understand that some of it can be biological, some of it can be environmental, some of it can be social and psychological. So all this can affect people and they can start performing, or rather they start behaving with challenging uh, traits. Okay, so common characteristics: non-verbal agitation. You can see people agitated, wandering. You just have to watch and say, what's going on here? And try to understand, not aggravate issues. There are a lot of characteristics. They are verbal, non-verbal, and you are physical as well. So you can check, and sometimes some people can grab, and sometimes you see people with marks and all. You have to find out why they're having that marks. It could be that they are trying to talk and tell you that they are going through um, some issues. So some things that could be causing challenging behavior can be a lot of physical diagnosis. Epilepsy is part of it, yeah. So cognitive, like I explained earlier, so somebody that has memory loss can be afraid, it can be autism, then psychological emotions, afraid, anxiety, depression, environmental reason, social reason, can be darkness, maybe the place there's no light at all. And it could be very warm or too cold, overcrowding, lack of information, so many reasons. So this brings us to cultural diversity. Yeah, cultural diversity. So as a professional, you will deal with a diverse range of people from different backgrounds on a daily basis. So when you have people that are from uh, uh, different background, you will need to assess and look at the situation and kind of understand what you should do and what you shouldn't be doing. So culture, people have different culture. Some people, when you stand to talk to them, it's like you are insulting them. Some people, when you sit to talk to them, it's like you are insulting them. So it's all differs. Everyone is different from different background. So we need to understand that as a person, you need to first understand the person, then understand how challenging behavior can affect them. So you need to, there are several areas you can look at people there. So the people, the places, right? Task and the time. So where people are having challenging behavior, yeah, if you understand that, put this into points and say, okay, uh, what are the people that can have this problem? You look at it and say, oh, why is this location, why is this person having this problem? So you'll be able to determine and say, I'll work with this person in certain ways and find a way to work. So I want to stress on this, that preventing a violent incident is better. Yeah, it's better to prevent than to escalate or make it and always, anything you do, always document it. Documentation. If you never document it, it did not happen. All right. That is the policy. Not documented, never happened. Okay. Identify aggressive body language so that you don't fall into it. Preventing challenging behavior. Yeah. Preventing behavior, the challenging behavior while someone is in distress. So you can find know about their vulnerability and you know um, anticipating needs, designing care accordingly. All right. So fear and anger are two common response to challenging behavior. Okay. So we don't do that. The fear shouldn't be. So we will get a lot of them during a course of doing the domiciliary care or home care service, or even telemedicine as well. So you will be able to see where these people are coming from, what is happening to them, why are they having this challenging behavior. All right. So you look at the person, look at their history, look at what brought it and prevent it. Do a risk assessment, do a personalized care plan, consider mental capacity, decide the best plan, course of action, provide staff with training. So that's what we're doing now, providing people to understand. So when you meet people like that, when they're a bit off track, you might be able to understand that they have a mental uh, mental health issues and some situation that they need support with. So you just need to support attitudes and attribution. So human beings are very diverse. So have many similarities and a wide range of differences. So the social groups we belong to help form our just form our identities a lot. So when prejudice um, is a negative attitude and feeling towards an individual based society on one's membership in a particular social group. So you might be there and there will be discrimination, they're picking on you or something. So you just need to understand what to do if such thing is happening to any of our clients, and you need to step up and try to stop it. So values and beliefs. Yeah. So your value, your beliefs has to align with the company's value and beliefs, because it's like when a family is trying to show you um when they try to tell you about, maybe they come to you and they tell you about their own side of the story about their, what you will do is to consider all that they will tell you. They tell you about the person because they'll tell you about the history, they'll tell you about what they know, how they be caring for their loved ones or so, especially in the community like this. So their belief system, their values, very important. Spiritually, morally, you have to respect their values. You have to, because to be honest, this value system and belief system, they are what governs a person on how you behave, how you respond to other people, what you do. So some spiritual beliefs does not accommodate a friendly approach. So you have to understand all that. Yeah, so social, intellectual, economical, political, religion, so many beliefs might not be able to work all that for you. So you need to understand what to do when you are in that situation. So need to understand the values and belief systems of people. All right. Conscious and unconscious response. So, well, there are times where um, unconscious response, a bias, is a term that um, describes the associations we hold outside our conscious awareness and control. It affects everyone. It is triggered by our brain automatically making quick assumptions or assessments and judgments which are influenced. Yeah. So these are areas I will not bring up there now. So we have several fight or fight or flight response. So there are sometimes something happens, you want to run, or you say, "Oh no, I'm going to stay fight it." So that's where you have those feelings, tiredness, attitude, beliefs, and it comes in. So there are situational awareness. All right. So there are warning signs before something will happen. You will be getting the signs. Yeah. So you might need to look at that area, look at those inner side, and use it when dealing with people and when uh, attending to clients as well. You might need to look at that. Dealing with workplace aggression. First step, assess, identify, reassure, talk, listen, problem solving. Yes, that's what I always say. Problem solving. Problem solving. So aggressiveness. So signaling non-aggressiveness, open arms, eye contact, and active listening. So you would try as much as possible if you know someone is angry and someone is not happy. You can always give them that space. All right, give them that space, and then let them cool off. When they cool off, they can always come back. All right, they can always come back and discuss. So sometimes it's not every time you talk. Sometimes you just don't talk. So communication, very important in everything. So types of communication, active listening. So you listen to people more than you talk. Listen, let them talk. So attend to this, to people. Try to um, repeat what they said. Maybe that will help to if they did not hear you properly, or if it's something that you did not hear, then you can speak to them. Yeah. So and you use active use of all the emails, uh, text message, use all the internet usage and all that. So this is all right. What's this one? Okay, so um Well, that is it. Communication tools. You have a lot of tools. So you have open self, blind self, hidden self, unknown self. So that those are the models. So effective verbal communication. Yeah. So you can do that with them, not just within yourselves as a team, but you can also use this to talk with um, the clients to make ends meet and bring revenue for the company. So there's LEAP, LEAPS, listen, emphasize, ask questions, paraphrase, and summarize. Yeah. And we also have what we call the PALMS, PALMS, position, attitude, look and listen, make space, and storage. All right. So some people like to be invasive. Yeah. So we would that brings that invasive brings um, a lot of um, conflict. Yeah. So there are different techniques. It's just that we don't have the time. When people are, I mean, this is, we're going to go past all this because we're not doing the PMV. And this I need to really work on. I need to stand and do it with you. So restraining. So we're not doing restraining. We will do that. Maybe that's a course on its own. I would maybe if we have time, another time. So we're talking about equality, diversity, and human rights. So Equality Act 2010. Yeah, so there are different types of discrimination and people are discriminated. So people that needs to be protected are the disabled, yeah? People suffering from disability, gender reassignment, don't mind this one. So equality duty. So there's nothing like man or woman in our work. We treat everyone with equal respect. Yeah, we treat everyone with equal respect. Okay, so and when there's any error, any bad practice, you need to report it. Whistleblowing. Yeah, you report it. Yeah, we have health and care, the Health and Care Act 2022. So you can want to look at that. That's very good. The main purpose of the Health and Care Act is to establish a legal framework that supports collaboration and partnership working to integrate service for patients. Okay. Care Quality Commission. Care Quality Commission. This is a body that takes care seriously in the UK. But in Nigeria, I mean, I talked to in Lagos, we have AFIMA, we have Ministry of Health and all that. So they take off, they really uh, kind of protect the patients or clients, the stakeholders. So dignity and respect, you have to respect. Service user have a right, the client have a right to exercise their choices and live in an environment free from abuse. So these are things you must be an advocate against abuse and work with people and make sure that the environment is safe. Person-centered approach, person-centered care upholds dignity, kindness, respect, and human rights. All right. So principles of a person-centered approach, empowerment. So you empower people, you empower them. Okay. So this is person-centered approach. That is part of it. You empower people, protect them, uh, try to prevent any anything that is not right. You prevent it. Um, Proportion. This is, I'm sure that the professionals will work for my best interest. Okay, so you must um, value value people's that you are taking care of, even your staff, people working with you. Discuss and have there are ways to work together with people, and particularly this approach is we are actually dealing with healthcare. So people that are coming in and out, we are able to give them the best. Yeah, we must be different because we know better. We are internationally driven, so we want to grow, and for that, we need to put our clients in front of whatever we do. We have to be selfless, yeah, selflessness, partnership. So we need to work with other people, yeah. Um, so we will keep the information of any client, under, you keep it safe. It's not something that you disclose. Accountability. You're accountable for things. You must show accountability. That skill is not every time you defend yourself. You don't defend yourself. You learn from mistakes and then you use it to move on to the next one. Makes mistake, but the why we're doing all this training is that we're doing the training so that people are aware and they'll be able to work towards a better goal for themselves and for the company. When you are going out and you talk, or when you do things, the kind of service, the kind of words that will be coming out from you, the clients will be amazed. They will be so pleased and say, no, these people are different. They are different from other people, right? It's not just you talk nicely today, the next day you want to scatter the whole place. So we need to be accountable for our actions, all right? So it is very important. Like I said, we talked about so people can be abused. They can go through all that. An adult at risk of harm is defined as someone who has needs for care and support and is experiencing or at risk of abuse or neglect, and is unable to protect themselves. So people that are unable to protect themselves, there are many in especially in developing countries. You see physical abuse, sexual abuse, psychological abuse, discrimination, organizational abuse, domestic abuse. I mean, there's a girl I was speaking to, which they were yesterday. She was very honest girl. I mean, that is why I said that girl should want to bring her out. But she was very honest with what she's getting and all that. And I said, don't worry, we will look into it for you. And she knows what she's doing. She's very good with it. So all these area, we don't want people to take advantage. But the problem is that when you are trying to do well for our people, then they tend to have a uh, long, how will I say it, long experience of sad story. They've had a long experience of where they've been abused. So when they see a company that wants to help them grow, they are not ready for that. All they want to do is, you know what, I want to be abused. So, I mean, this is something is sad, but that is the way some of it kind of sound. All right. So terrorism, well, we're going to talk a bit. Joint terrorism analyze analyzation center, or um, analysis center. So, and the security service, yeah, M15 introduced terrorism threat. So, well, this is particularly for the UK, but we're talking about terrorism is a global problem now, is a global problem. And Nigeria in particular is experiencing a high level of terrorism. Yeah. So there are 5 levels of threat. Low, an attack is highly unlikely. Moderate, an attack is possible but not likely. Substantial, an attack is likely. And severe, an attack is highly likely. And critical, an attack is highly likely in near future. So you need to stand against these acts. They are barbaric and unacceptable all over the world. So what the UK has done, they've done contest counter-terrorism strategy. So they put things in place for the country. So, I mean, these are things we can always also discuss with the government and let them know that, look, we can, there are things that can be put in place in terms of this. We can write report and say we can help in this area. These are the things we want to do because most of these areas that are red zones might not be having, they will not be able to get access to health care. Yeah, they might not be able to get access to health care. So when you are talking about contest counter-terrorism strategy, please study about this. Yeah, it's my help in terms of putting things together for you, and also you'll be able to detect anything that you see around. So we talk about contest, pursue, prevention, protect, prepare. All right, that's the contest. So pursue to stop terrorist attack, prevent to stop people becoming supporting terrorism, protect to strengthen our protection against a terror attack, and prepare to mitigate the impact of a terrorist attack. All right, so that's that. So terrorism, yeah, the Terrorism Act defines terrorism as an act that endangers or causes serious violence to a person or people. Yeah. It causes serious damage to property or seriously interferes or disrupt an electronic system. So it can be, there are some that are prevent. Prevent is a strategy they've used and they've implemented to reduce the threats to the UK from terrorism by stopping people becoming terrorists and supporting terrorism. Yeah, so we can actually have things like that in the development. So radicalization. Most people that are terrorists today, they started as a radical, but some of them now, especially in Nigeria, they are picking people from schools. You know, they are going to schools, they are picking young girls and boys and forcing them into this terrorism. Yeah, extremists and China. There are a lot of things, but we'll not go into that because it's in the UK, right? So there are many things, prevention, channel, they've done a lot of things in place for them. This is something we want to be advocating for, that we can do a lot of things for our own country, and then put things in place that will stop, that will kind of um, uh, handicap the people doing this so that they will not be able to carry it out. So there are ways they need to come together and do this, but I've not seen that happen. So clearly, Nigeria needs it, okay? So legal framework for the detention and care of mental unwell patients in England. So Mental Health Act, yeah? So Mental Health Act, I'm sure we do want to learn about this because it's a, a act that really helps those that are vulnerable, people with mental health problems that are struggling, or those that don't even have it, but there are situations they want to utilize it because they are going through one thing or the other. So this act does help. There are many sections in it, but I'm not going to talk about it here because we don't need it. So when anyone that will do the mental health training will be able to get that done. But I'll just, because you're going to be teaching about it actually, so but I'll just breeze about it a bit. So we have all the mental health, we have mental health sections, detained admission. So people that lack capacity can be detained. Yeah. So when they have mental health issues, they can be detained. Yeah. Once the doctor and nurses, if you have two doctors and one nurse that is trained, we call them AMP. So they are trained to do the assessment. Once the three of them sign and say that person has mental health problem, you are going in straight. The police are picking you and you are going in. There's no discussion about it. Yeah, you're going into the hospital, you'll be detained and you'll be put in the hospital. You can't leave. Yeah, because you are deemed that you lack capacity. Once you are deemed that you lack capacity, so the Mental Capacity Act is another one. So that's the one that governs whether you have capacity to make judgment or not. Yeah. So what is capacity? Mental capacity is a person's ability to make their own choices and decision. So can you make your choices? Can you make your decision? So if you cannot, if you are impaired with this ability to make decisions, you lack capacity. Or if you cannot understand what is spoken to you, what is communicated to you, you cannot understand it, and you don't understand the information, you can't retain information. Yeah, if you can't retain information, you can't weigh the information and make decisions. And then if you cannot communicate it back to and say, oh, you said this was what you said, this was what you said, then you lack capacity. And well, you can lack capacity today and tomorrow you might be having the capacity. That's what it's about. At the end of the day, capacity are principles attached to that. So you can study the Mental Capacity Act on your own. All right. So we have the Prevention of Liberty Safeguarding. So this is they call it DOLS. We call it DOLS. So this is another way to keep people in the hospital. Yeah, you can keep people in the hospital with that. So I will not go into that too much again. So you have Human Rights Act. So everyone should be protected, uphold and protect the rights of people in their care. So every organization, yeah, so they aim to ensure that every organization are upholding and protecting the rights of people. So you have to look at take good care of those that are coming as clients to you. Places responsibility on the organization to promote and protect an individual's human rights. So your human right is protected. So there are some, with fairness, respect, equality, diversity, and autonomy. So to let people make that informed decision. They might make mistakes, but let it be so. The human rights have 16 rights. So you have to look at that. I'm not going to talk about that now. Yeah. So you can go and look at that to be nice. So yeah. Mental health conditions. So there are different mental health conditions, right? So mental health can be positive as well as negative, okay? The positive one is the mental wellness. Yeah, you have your well-being, you understand what you're doing. Yes, I'm very good. Then the negative one is the mental health illness. There are mental health illnesses. Okay, cognitive disorders. So the cognitive disorders has to do with dementia. All right. So is a category of mental health disorder that primarily really affects the following: affects your learning ability. It affects you from learning. It affects your memory. It affects your memory. Okay, whereby some people, dementia, there are different types of dementia. I don't want to go there. There's a cause for that one. So you'll be able to know what is happening in the past one, and you can't even know what is going on in the present. So you see somebody calling his brother. He'll be calling daddy, daddy. A 90 years old person is calling daddy, daddy. That's my daddy there. You see, so they kind of see things. They see when they were young, when they were small, like 5, 10 years. That is what they will be remembering. But they cannot remember what they've done as a grandmother. All right. So they have perception. Perception is an issue. So you can have disorder with your perception. You can have disorder with problem solving, right? And all this can be as a result of amnesia. Amnesia can be temporary. Yeah, there can be temporary. You can just lose it, maybe due to one, maybe you had accident or something happened, a knock in the head, or there might be operation or whatever. So you cannot, it can be for a very long time, you cannot remember even who you are, right? So you have dementia, like I earlier stated. Dementia is a big part of this. So you don't even remember, and then you remember some things, and dementia is a progressive illness. It progresses. You start from one missing one word to end up with not even knowing who that person is anymore. You can't even know your children, can't know the where you move to. And the funniest thing with dementia is that you don't even know who we have it. You don't even know who we have it, because it doesn't write any letter to announce itself. So it can happen to rich people. It can happen to poor people. It can happen to anyone. All right. Dementia is a slow killer. We call it a slow killer. So you have delirium. Delirium is short term, yeah, but sometimes it's always people mistake it for dementia, but it's not. So it's a short term. You can be due to sometimes infection. Some people can have infection. We call it UTI, yeah, urinary tract infection. You can be any other thing, and then at that moment, the person will just be demonstrating or possessing some traits like dementia. But if you look at it properly, so that's why we always leave people for some time. Don't start them on medication for a while. Let's see if it's dementia or just delirium. Yeah. Okay. So there's a training for the mandatory training for disability and autism. There's special one for autism, yeah, and also learning disability. We have it a lot in Africa. Learning disability, where children, as a result, there are many things that causes it. Generic conditions such as Down syndrome, all right, which happens as a result of an extra chromosome. If you know biology, this leads to impairment in both cognitive abilities and physical growth that range from mild to moderate developmental disabilities, right? So complications during birth, which can lead to lack of oxygen. So oxygen is very important. So sometimes lack of oxygen. I see where somebody, when the baby was in the womb, the baby had the cord around the neck and got to a point it couldn't, they were saying it lack oxygen and they had to remove the baby immediately. All right. So there are many things. Some of it can even be injections. I've seen where people they're giving polio um, immunization injection, and it became a problem. Okay, injury, illness in childhood which has affected the brain, so such as meningitis, yeah, that can cause learning disability. So it can lead to difficulty understanding information. They cannot process information, difficulty communicating, difficulty living independently, and difficulty learning new skills. You know, they are just can't function, yeah, unless you you help them through it. So barrier to supporting a person with learning disability, all right? Individuals may have physical, sensory condition or difficulty responding to feelings, emotions. They may express themselves in ways that others find difficult to understand, which can in turn affect how others see or respond to them. Okay, so possibly this could become barriers faced. It could become barrier to people that will be taking care of even their family members when they are supporting them. Okay, so the barriers, that some of the barriers will be you know, can accessibility. So can you gain access to their room, areas or service or something? So they sometimes they have a behavior that you might not be able to enter their room, and you know they have some routine. I mean, like autism, they work on routine. So they might not wake up at 6. Some of them, there's a time they wake up, they might say they wake up at 10 or 9 o'clock. That is their routine, and that is how they want it every day. So you just have to understand that stereotyping, people's attitude, judging people the same because they have the same condition and assuming they will be affected in the same way. Okay, so you don't treat everyone the same. Everyone is individual. So as an individual, you treat that person as an individual. You don't treat everyone as the same. Nobody is the same. Okay, so the organization approach, ways of working meets the needs of the person, not the organization. So you work on our clients, the person, in that person that is needing support is that person you will be looking at. What does that person want? That is what will be looked at. That is the needs of that person. Yeah. Adapting a service user scale and support. So you are looking at what is needed for that person. So you work according to what they want, not according to what you want. So you have to adapt to their requirements. Okay. So autism awareness. So we all know what is autism would be. If we don't, we should go and study about autism. Yeah, 80% of autistic people also have some form of mental health illness. All right, so we need to look at that. Don't be quick to judge, to run into judgment, or um, just take them for that. You have to help them through. An increased risk of autism is coming. Many risk factors now. People are getting more and more autistic children these days. Yeah, so we need to be mindful and support them. Then they've kind of gathered all the different types of autism and they've put it under one umbrella and they call it autistic spectrum. Yeah. So autistic spectrum. So we have a spectrum for it. So it's a spectrum. Yeah. So you can have it might be little things and there might be other things so some of them are very good. They are very intelligent and they can function very well. But while others cannot. So some of them has difficulties in social interaction. Yeah, they find it hard to understand, to communicate, recognize. So we usually have all these, we have a kind of, cartons, or what do you call it? You can cut some um, boards, and you write things, little things for them to be able to um, assimilate. So you put it them and say ball. Then they will look at you. You can put the ball, the drawing of that ball, so that they can see it and know that it's ball and things like that. So you have to work with them. Yeah. Stage two. So there are things like difficulty with communications. Yeah. Struggling with verbal and non-verbal language. Okay. Stage three, difficulty with social imaginations, finding it hard to imagine what others are thinking or alternatives to current routines. Okay, so there are complications with it. They have relationship issues, unemployment, inability to function, poor general health, increased vulnerability, reduced quality of life, premature mortality. Many of them, they die at the age, some of them die at 30, 40, 50, and there you are. So they find it, they don't live longer like they should. Yeah, it's a very sensitive area. So addressing then people with autism. Yeah, most common description, people, when people say person with autism. Yeah, so that that is the word, the commonly used word for them. So we don't use other words to for them. Okay, so we try as much as possible to reduce what we use. We don't want to escalate or turn it to a problem for them, because they are very sensitive to whatever we do or whatever we say. Yeah, communication. A person with um, autism spectrum disorder may interpret messages differently. So you have to be careful how you come across to them. Yeah. So communication, person with autism, communication in various ways. So like I said, you can write it, you can write in a small letter, you can do it a very clear, maybe voice notes, bit by bit. They usually carry a passport. They can carry hospital passport where they write all their details, what they like, what helps them in case of anything. Yes, so those are the areas for them. So sometimes they have meltdown. So when they have the meltdown, uh, we just have to find a way. That's why you have to have the care plan. You have a support, we call the personal support plan. Yeah, I would like the nurses to take a record of this one. Personal support plan. So the personal support plan is about the person, how they want to be cared for, how they want to be treated, and in case of anything as such, that when they have that meltdown, yeah, how do they want us to. And there's another one they call the shutdown. That is, they've gone down totally. They will not respond to you at all. They are not talking to you at all. They're not doing anything. So there are many sensory sensitivity with them, many things, treating someone. So we treat them in a way. Some of them, they take medication as well. Some are the environment. We make sure the environment allows, make sure environment allows people to to treat them like a normal human being. Friend, I'm taking my time on this because I know there is a lot of people with this in our community that we really don't even know about. They have them a lot. So I'm taking my time to explain about autism, so that when we have them, we'll be able to teach the others how to go about autism, because it's a very sensitive one and we have them a lot. All right. So Individuals refusing to be assessed. Sometimes they might say they don't want to be assessed. So then we need to find ways to do that. And the family can give us a written consent, and they can give us consent. If they cannot, if they have family, the family can give us consent if for us to assess them. We assess them, do documentation. There's an assessment for autistic people or people suffering from autism. Yeah, because that's the way we use to pronounce it. We don't say autistic people. That's a very wrong one. So we say people having autism or a person having autism. That is what we refer to. We give them that dignity. We respect them. Yeah, we don't just throw words as a tantrum. Mm-hmm. You just throw it and say this person, this big head person or that. We don't do that, okay? We are professionals. We show professionalism in every area. So Moricol, holds us an high esteem for each and everyone and expects everyone to be in that category. Yeah? Okay, so reducing the risk of abuse, criminal records checks for staff. Yeah, we do all criminal records for staff anyways. Yeah, safe recruitment process, multidisciplinary care, patient-centered, like I've always said, safeguarding policies in place. Yes, procedures and guidelines. So there must be safeguarding policies and procedure in place, okay? Reporting risks to patient safety and quality of care. So we do that. Learning from incident to improve patient care, supervision and staff appraisal. We're supposed to look. It is, if you are not having your supervision done every month, it is your responsibility to have your supervision done every month. So if you've not done your supervision since you've come, I mean, you are actually liable for many things. It is your right. It is you that you are in charge of your supervision. So ask for your supervision to be done. It shouldn't take, sometimes it might take only 10 minutes. You just do it and the report done so that it's thought that, this is where you have opportunity to talk about things that, what you suggest, things that you want to grow and things that you want the company to put in place. So you put that. That is a very good method for you. It's actually in your portfolio. It is put in your portfolio for all your things. That is where they talk about the things that you've done, where you are lacking, and then where you need improvement. Okay, so information for patients, families, and the public. Okay, safeguarding adults. Yeah, safeguarding adults. There's 7 stages of safeguarding. Consists of alerting, referring, decision to investigate, strategy, investigation, case conference, and review. Yeah, so there are different processes for safeguarding. All right, so I will not talk about all these processes, but you just try to. There's a cost for safeguarding. So recording incidents. So it is paramount. I repeat, it is paramount that you record all incidents, whatever happens. Record, even if it's near miss. Oh, something happened. Oh, it didn't happen, but it almost happened. Record it. Record it is very important. Yeah. And when you do it, send me a copy. Yeah. When you do it, send me a copy. It's very important. Okay. Record incident reports, right? You record it and send it. Okay. You write it. If there's any injury or anybody, you can. That is why we're talking about the body map. Yeah. Complete that accurate body map if there's any injury or anything, and then whatever it is. Okay. So those are the stages of safeguarding. They have safeguarding adults and safeguarding children. All right. So safeguarding children is very important because we care more about the children. Not that we care more about the children, but we don't joke with children. Children are, you have to take care of them, and don't let anyone, you have, whether it's in your possession or not, you need to look at that. Okay, so these are the things to know. Emotional and physical abuse. A lot of children are abused, disabled children, potential risk to unborn children. There are so many. We have a lot of, Africa, we do this female genital uh, mutilating. So we do the mutilating where we call it, there's another word I was looking for, that we are used to calling that, where circumcision, that's the word I was looking for. They do it to the women, they do it to men, and they do it to women. All right. So, and it's classified as abuse. Okay, it's classified as abuse. So, if any body does that in the Western world, they will be arrested. Any mother or father, you'll be arrested. Yeah, and they'll take that charge from you. All right, so it is not allowed. Okay. Now, social networking and internet use, yeah, posting personal information that can identify and locate a child offline. All these things, yeah, are crime. They are crime. Like I said earlier, you are not putting your personal things using the company's um, internet to be doing your stuff and all that. It is fraud. I've talked about it for those that were not here. It is fraud, yeah? So if you are doing it, stop it now. I've told you to use your work stuff to work, your work equipment, okay, your official equipment. So there are many referrals, how to refer and all that. So I'm not going to go into all that for the social services. I'm not going to go into that. So we have all that for children. There are lots. In fact, if you want to talk about the children, to take you like 2 days to do. So we're going to the manual handling now. Yeah, I think we're almost done. Wow, I was just rushing anyway. So manual handling, I was talking about it earlier. I said we'll come to that. So we come into tissue viability and pressure ulcers. When people stay in one place for a long time, they tend to develop pressure ulcers. I mean, I'll just talk about one of my clients that I had. The client had mental health issues, and what happened was that I don't know if it's mental health issues that actually prompted him to do that, or if he did it because he was running away from what is called punishment, maybe from the crime he committed, because he went to court. I think the court did not grant him what he wanted or whatever. So at the end of the day, they were going at the train station. He was standing with his mother, and the next thing he did, he just went in front of the train. The train just picked him. And oh my God, the train picked this guy. And I don't know. In fact, I really don't know how it happened. So from his we call it storm, yeah. From this part of from his waist down was gone. All right. So it's just from the, how am I going to describe it? Just from the, oh Lord, from this part, just by, um, I would say the, just beneath his genital area, just from that up is okay. That survived, but the other parts was gone because they had to cut everything away. Oh my God, this guy. So we had to get a wheelchair for him and all that. So he sits on the wheelchair and he starts developing pressure ulcers. Pressure ulcers so deep that and oh gosh, it was, let me just say, it was a nightmare. I don't, in fact, I never wish to have a client like that, or a patient like that in my life. It was so bad. And he has bad attitude, bad character, and very disrespectful. Oh my God. It was a big problem. So, tissue viability. So you are specialists for that, yeah? So specialist that considers all aspects of skin and soft tissue wounds, including acute surgical wounds, pressure ulcers, and all form of leg or ulcers, yeah? So the tissue viability, yeah? You can study that one. Tissue Viability Society 2009. Okay, so the pressure ulcers, how is this formed? So injury that breaks down the skin and underlying tissue. They are caused when skin is placed under pressure, sometimes referred to as bed sore or pressure sores. Yeah. So when someone lay down in one spot, so that's why when we are treating people, we tend to turn them. We have a chart, turning charts. Okay, we have a chart called turning chart. Please take note of that. Yeah, take note of that. Turning chart. So this chart, you give it to make sure as you are going to care for people at home, they have this turning chart. So you have to every hour turn the person, yeah, turn the person to the right or to the left, or turn, you keep turning, especially those that cannot move, that are, paralyzed. Many people are paralyzed and they are on one side. Some people have stroke. As a result of stroke, they get that paralysis. So you have to turn them. Don't leave them on one side. If you leave them on one side for too long, they start developing bed sores, which automatically becomes pressure ulcers. Yeah. So there are different types of pressure ulcers. There are three main types of pressure ulcers that can lead to development of three different types of pressures that can lead to pressure ulcers. All right. So interface pressure, the pressure of the body pressing the skin down onto a firm surface. Yeah. So they call one shear. So the shear one is the pressure that occurs when layers of the skin are forced to slide over one another. Right. Then we have what is called friction. Okay. Friction. uh, uh, this is when pressure caused by something rubbing against the surface of the skin. Okay. So pressure that is placed on the skin through involuntary muscles. Yeah. So such as muscle spasms, moisture which can break down other than the skin, the epidermis. Yeah. So those of us that the nurses will be, they know what I'm talking about. So common pressure areas, yeah, pressure ulcers area, shoulders, elbows, back of the head, yeah, rims of the ears, knees, ankles, heels, toes, spine, tailbone, buttocks, Yeah, back of the arm, legs, that's legs due to wheelchair, yeah. Back of your hip bone, wheelchair user. All right, there are different types and severity of pressure ulcer. So their severity can become, it can start developing and become worse, yeah, can become worse. So we use grading, we grade them, we grade them from when it's very little, and when it start developing, we start grading. Okay, there are different uh, way to create it. Yeah, the risk, increased risk is when sometimes mobility problems, like I said, when people are paralyzed, poor nutrition, when they are not drinking enough, underlying health condition, being over 70 years old, urinary bowel incontinence, mental health conditions, smoking. All right, those they can be um, a factor to making it worse. Okay, so I mean, person-centered approach. I've talked about that. So we have to always use uh, maintaining personal identity. All right. So, um, well, I will not go into that. So one thing I want to say is that consent. When you go to anyone's place or someone talks to you, a client talks to you about what they want, make sure the client um, gives consent before you pass information to someone outside. You need to speak to the. Most times when I want to speak to clients on the phone, or when I'm working, I usually pick the phone or call them. I say, "Hello, ma'am. Hello, sir. Yeah, just for your information, this conversation, um, I will have to relate it to the team. So anything you say here will be related to the team. So can I go on? Say yes or no, and that's it. So there's no, if you say I can't go on, then because I have to make notes that I spoke to this person and this is what they said, and I have to know that, yeah. So you address that to patient. Um, so factors you need to know that affect the client. There are various factors which may have, affect the client ability uh, to assist, manual handling approach. So we're talking about manual handling now. Would be a physical problem, communication, behavioral, cognitive, lack of equipment, and things like that. So we must look at ways, put that the patient's movement, if they are able to walk. When we are doing assessments, we need to make sure we understand that this person can walk or you cannot walk. Because if they cannot walk, that gives us another, would be know that yes, that person might need more than one person to care for them. Okay, if it's one person, we need to know the level of mobility deprivation that person have. Yeah, the challenges they fall. Is there any problem? So we need to carry out all that in the care plan. Yeah, when we are giving the care plan. So when we want to lift people, we need to be very careful. Like I said, I've talked about lifting today. Yeah, I've talked about lifting. When you want to lift something from the ground, you have to watch out for your back. Yeah, so you need to use the ergonomic approach, which is environment, load, individual tasks and equipment. So it's called elite. Yeah, it's called elite, and we have different acronym, but this is the one we're using. So you have to look at the environment. Where are you lifting the person from? Assess the routes before you move the person. Make sure, is it stairs? Is it narrow? Is it doorway? Where are you moving the person from? Uneven and slippery floors, or so many things that you need to think about when moving people. Yeah. So if it's a better route or that route is working well, if you are one person or two, you need to understand, look at the space that the load represent the person that you are going to be moving. So you have to assess, is the person able to walk? Do they have stability? Would they be able to hold something and stand up? Maybe you just give a little bit of push, a little bit of support. Maybe they can stand, but they can't walk. Some people can stand. They have stability, balance, that they can stand well. So patients may be attached to medical equipment. So we need to know that, are they going to, when the person doesn't stand up and it's difficult, so we can either suggest and say, look, maybe they can have a OIST, which is very expensive. You can ask the family if they would like that, or you get two people, depending on some people, they are very big. So how do we do that? We need to, sometimes patients, they are aggressive. We need to look into that, and they may be feeling pain or anxiety and things like that. You need to consider their dignity as well. When you are lifting people or doing this, make sure they are well covered. They are not part of their body is being seen. So you look at that. That's an individual. So who is doing the lifting? Is it one person? Are you able to do it effectively and carry it out without causing any problem, any danger, or anything that would become a result to fall? So, while completing all this, you'll be able to decide if it's something that you can do or not. Yeah. So these are what I would say. So spine, I was talking about the spine earlier. Spine provides strength and protects the spinal cord. Like I said, the disc is the jet pad, the jet pad to when you have your, they are like this, you have the disc, you have disc like this, and you have gel in it, and they are so that they don't rub another one. So you have the gel, then you have another disc again. So there's a special way God created also. The spine is made up of 33 bones called vertebrae. So they are called vertebrae. So this cervical vertebrae is there, and then you have the thoracic, yeah, you have thoracic, and then you have the lumbar. The thoracic is actually the longest that we have. So you have the sacrum. So when you go in that, so you have the cervix is 7, yeah. Cervix is 7. So you start counting, the cervix is 7. Then you have thoracic, yeah, which is 12. Then you have lumbar. You have lumbar, which is 5. Then you have sacrum, yeah, and you have the sacroiliac joint, so which is usually on that waist part and all that. So so at there you still have the cossack's at that is, we usually say we have we usually say we have tail, isn't it? People usually say human beings have our own tail. So that's that one. So that is the spine. So you must take care of your spine. You cannot just be bending like this to take things, bend like that to take things, bend like this. No, you can't be doing that. So you have to squat. You have to go down. I wish I can show us, but I mean, we can squat and make sure your knees are bent forward, and then you can pick whatever you want to pick. Make sure you don't injure yourself. Yeah, make sure you don't injure yourself. So you can lift objects. I mean, I'm not. There's a training for this. For the how to lift things. So injury type. There are 480,000 work-related musculoskeletal disorder reported 2019 to 2020. So there's so many problem, and most of it, the neck area and lower back are where most injury occurs. Yeah, so your lower back strain, sprain, damaged disc. So we don't want that for anybody. So you might need to, that's why we're doing this training. So you've been trained, so you don't have to go and um, do what the company is telling you not to do. So if you go and do it, you are on your own. Yeah. So you use your legs. Use your legs to raise your body up. Yeah. Use your legs to raise your body up, not your back. All right. Avoid using your back. Yeah. Stand over the object if you want to lift things. Stand over the object with your feet apart. Keep the object close to your body. Position your feet at the sides of the object. Lower your body. Keep your back straight and bend your knees. Stay balanced and take a firm hold on the object and keep it close to your body. Keeping your back straight and head up, then use your legs to raise your body to a standing position. Keep your back straight and head up. Move slightly into your new position. All right. So that's just basically what it is. Definition of a fall. Yeah. The process of uh, physiological activities following a long period of sedentary lifestyle. Yeah. So that is the conditioning. Well, that's the conditioning. So the patient can lose mental state, muscle strength, continuance, and be unable to take part in normal day-to-day activities when they fall. Okay, so a fall, yeah, is an unintentional event that results in a person coming to rest on the ground or another lower level, not as a result of a major intrinsic event, such as a stroke or epilepsy, or overwhelming hazard, yes, such as being pushed. Okay, so that is a fall. A fall, you were not pushed, right? When you are pushed is a push. That is a crime. So when someone falls, it falls uh, is an unintentional approach. Yeah. So falls risk as factors. There are risks attached to fall. Yeah. So we have the intrinsic and we have the extrinsic. Yeah. So which is individual and environment. Okay. So there are different, parts of the intrinsic. So previous fall, fear of falling, age-related changes, certain long-term medical condition, medication can even cause it, visual or hearing impairment, cognition, problem, age over 65, dehydration, and malnourished person, or weakness and walking problem. The intrinsic factors, hazards, yeah, clusters, poor lighting, wet flooring, low temperature, overreaching, incorrect use of walking aids, inappropriate footwear, tailoring bed wear. All right. So these are risk factors associated with falls. Yeah. So we always have falls charts. It's very, very important. I cannot stress more on this one. It is important that we have that fall chart so that you can be able to identify when anybody, it falls, the time, whatever, you can document it. Document it. I've said my own. No. So assistance and equipment. So there are different equipment. OS, camera X system, we have the overjack air patient lifting. If so many things. Assistant, you can have slide down a wall, allow the person to fall, you know, block sharp objects, remove obstacles, redirect a fall. So there are many things. If they are sharp objects, you don't want the person to fall on top of those. So there are ways to support. So we have many things, equipment to support. Yeah. So we have this. There's. I wish I can show us, but I mean, you can check it. So we have. Um, we call it Zimmer frame, yeah? That's what we call it. So you can check it up online. What is Zimmer frame? You'll be able to check. So you can use one person or two people can assist someone to use the Zimmer frame, okay? They can sit on the chair. When they are going to the bed, you can put the Zimmer frame in front of them. They'll be able to push themselves forward. They'll push themselves to the edge of the chair, and then when they push themselves, they'll be able to, you just support them a bit. Hold, put your hand in one of the side and support them, and then be able to move them up gradually, and gradually, and they stand. Yeah. Sometimes I do 1, 2, 3, and they just stand. Sometimes we try the first, it doesn't go. We try the second, and we try the third. They move. Sometimes you need two people to assist, depending on the care plan that is written for that person. So you assist them. Yeah, it can be independently or it can be assisted. Yeah. So yeah, so that is how it is done. So another one that can be used is transferring. You can use transferring belts, yeah, or turntable. Yeah, we call it turntable. So that is for someone that cannot stand up, use their legs. Maybe their legs is totally gone. They can't use the two legs, but they can move the bum. They can move themselves. The upper body is working, but the legs are not working. So what do? We just use turntable. Yeah, we use turntable. So that means we'll put the turntable. We can put the chair close to the bed and put that turntable. So we just move the person. The person will just slide and slide. Yes, slide and slide and slide on the turntable and start moving themselves until they go to the bed, and then we can take it off. Yeah, and they'll be as long as they are secured on the bed. All right, that is all. Sometimes we apply sliding sheets. Yes, sliding sheets. We can use sliding sheet when they are on. You can use sliding sheet on the turntable as well, or you can use sliding sheets on the bed to turn the position, to turn them, and we use hoist. All right, so hoist is a machine. Is a machine that will have belts. Will have a place where the person will be. It will go through the legs. There are different types of oils. So it will go through the legs and you pin it to the machine, and that machine will raise the person up from the chair and move. Then you now move the person. Meanwhile, make sure that there's brakes in the machine has brakes, and you can put on the brakes to keep the machine stable. But when you are moving the person, make sure you release the brakes, because if you go and if you don't do that, you might just endanger that person. Okay, so but make sure you release the brakes. The person goes on, and then it's usually two people that work on that. Yeah. Okay, so that's the hoist, and you take the person. Not Don't make sure it's not very far. It's not that when the person is in, the person is one place in one room, that you use the hoist to carry the person from that room to another room. No, so you need to use maybe a wheelchair. All right, maybe a wheelchair. Use the hoist to put the person from the chair to a wheelchair, just close to the person, and then take the wheelchair with the person close to the bed, and then take the hoist again to the to the to where the person is, and do the same procedure you did while taking the person from the chair to the wheelchair. You do it again from the wheelchair to the bed, and let the person lay in bed, and you take care of the person. Make sure everything is changed. The bed sheet is changed. Things are done properly for the person. All right, we don't play with them for that. So those are there are many things that you can use to stand aids. You have a lot of stand aids. There are sealing oils that is used in the hospital. Most hospital you have transfer rotor stand. Like I said, make sure you have your fault chart. So I mean, this is all about. So the immediate life support. There's an immediate life support that we cannot do today because we don't have the equipment. I need to do it live with you guys, or you can watch YouTube and get that. So maybe we can look. I'll look for one and send it across so that you guys can watch it. Yeah. So you have to recognize and escalate or escalate a deteriorating patient. When you have a patient that you identify that this patient is deteriorating, quickly you have to identify that quickly and report it and follow effective precautions or intervention to improve the patient's outcome. Using evidence-based guideline, quality standard, measuring patient outcome, safety incident reporting, not technical skills, use of common communication tools. So make sure you follow up whoever you have your patients. Make sure you follow up everyone, even if you have staff taking care of patients. Make sure you go there once in a while to go and look at what is happening if the patients are all doing well. Yeah. Yeah. So that's that. National early warning scores, news. So we use news now. So the news is going to record the respiration rates, oxygen saturation, systolic blood pressure, pulse, the pulse rates, level of consciousness or new confusion, temperature, right? So this is what is being used, and we use it to measure. It's very important that we have that as our chart. Yeah, it's very important to do that. Is tends to show. We used to use before we are using the MEWS, yeah, which modified, but they've changed it to national. So this is totally different from the other one. It has a scoring system, yeah. So we use that a lot. So clinical response, it shows the clinical response, how you can use it, the threshold, triggers, and recognitions, yeah. The reports, recommendation, frequency of clinical monitoring and all that. It does show all this here. So very important that you do. Okay, you look at this. Go and look at it properly. You can Google it and it will show you. And we have the approach recognition, yeah, for when we are doing basic life support. Yeah, basic life support. So yeah, so when somebody collapse, so you shout for help and assist the patient. Yeah, you start CPRO immediately, and why you ask others to go for help. Yeah, so we all know how we do our how we do the breast pump yeah. So you just don't leave the patient like that. You start the CPR whereby you do your breath. But these days they are saying there's no point of breath again. That's the new one that came up again and said, oh, you don't have to do breath. But I mean, you can still do. But they said for children, it's very important for children. Yeah, for children to do that, give the breath. Yeah. So if you don't want to put mouth to mouth, so always have, I have it in my list. I have the um there's a special, I think if I'm coming, if you guys can remind me to buy it. I just forgot to put it with these things that are coming. It's like this. So you have to put it in the mouth and blow the oxygen because they need air. All right. The most things that causes the children so is air when they don't have enough air. So that's what they need to come up. Okay. So when people drop like that, the first thing you do is start CPR. So recognition, ABCDE approach. Yeah. We will all these are videos. Yeah, we have videos for this one. To do it. The airway, clear the airway, breathe, circulation, and disability and exposure. So it is we can use the, what's it called? The video to check, but obviously we don't have it here now. You can check it online, yeah? So you assess the area, yeah? Check that there's nothing happening to them, call for help, communicate effectively with the team. Yeah, make sure that the person is alive. All right. If the person is alive and the person is breathing, how do you check? You can put your ear there to the person's nose and you can feel the air coming. Yeah, you can feel the air coming and you know that the person. Meanwhile, you've already checked for danger around, making sure that there's no danger around that place. Yeah, and you shout, help, help, shout, help. Can somebody help? Can somebody help? Yeah. So don't play. I've seen situation where somebody fell down like that, and people were just laughing in the party. And when they were laughing, by the time they know that person was pronounced dead. Let's not be uh, ignorant like that. Yeah. So anywhere you go, be attentive. Like for me, I carry my small purses like this. I carry it with me. To be honest, I don't even know where it is now. Oh my God. I have to look for it. I carry it along with me all the time. So we need to get one. Yeah. You understand what ECG, what they're using for the response and all that. So airways, you clear the airways, obstruction when you are doing that is when maybe when they brought the just to make sure that the person doesn't have anything. It's always with choking anyway. So there's the breathing, make sure the person is breathing. So you do the check and check the pulse and check the breathing and make sure the person is okay, circulation, check hand color and limb temperature, you know, cap, uh, capillary refill time is over 2 seconds. Yeah, so just to make sure that the person's blood is going well. Oh Lord. Okay. So yeah. All right. So you can check and the blood sugar to see if just to check if the person is not drug induced or if the person is conscious. You just put the person on recovery position. Yeah, put the person on recovery position, and while you call for help, someone to come and carry the person. I know in Nigeria you don't have. I see it in Lagos. In Lagos, they have um, the ambulance that can come and rescue people. All right. So we can do that. If not, you can start with the resuscitation. So if you have defib, I will try and bring that when I'm coming for training. The next time I'll come, I'll bring at least 2 of it, one in Benin, one in Lagos for training. They are very expensive, but I'll still be there. Some for especially for training. So we need to use it. So I mean, what defib does is that it restarts the heart. Yeah. So for those that are not breathing, so after you've done um, the breath, and you've done the thrust. After you've done that, and it's not nobody, the person um, uh, doesn't how will I say it? It doesn't revive the person. So the next thing you will do is to use the defib. The defib has saved a lot of people. So you shock, make sure that the person is not having any pacemaker. Yeah, if he's not having, check all that, and um, there's nothing like maybe metal around them. So if they're having metal around them, you have to remove it from their body. If they're having zip that is metal and all that, you just have to remove that zip, and so that it doesn't shock other people, because it's electricity that's you're using to start the heart of the person. All right. So you put it there, patches. You put one is going to be here, and the other one underneath the as a woman underneath the bed, but the man will be for a man it's easier. So once you have that, you'll be able to the machine will even speak. It will tell you, stay away now, stay away. Then you press it, say it's going to shock you, shock, and you see. And once that before that machine is there, you have to continue to do uh, the CPR for that person. Yeah, you continue to do the CPR. There's still other one for choking, when someone is choking. Yeah, so when someone is choking, we have the way to do it where you have to pull the person, like you have to, it's trust, isn't it? You do 5 like that and 5 back blows. Yeah, okay, and see, make sure maybe somebody ate something and the person is choking, and you have to do it until that uh, it comes out. If the person then uh, falls into unconsciousness, you just put the person down and start 30 compressions and 2 breaths. Yeah, 30 compressions like this, like that. You do it on this part of the chest of the person. I mean, my own, I don't know. So, but you just, I mean, when somebody is lying down, it's totally different. So you do that like 30 and then 2 breaths. Yeah, for the adults. This I'm talking about adults now. Yeah, and yeah, continue until the paramedics or someone come to save them. There's somebody. All right. Or if they are not, they are conscious, then you put the person on recovery position. Yeah, to assess whatever happened. Then you wait for response to come, and you can take turns. You can teach them how to do it. Somebody will be doing it if you are tired. So you take turns until um, you get help that will take the person to the hospital. Yeah. So oxygen is very important for people, when they're having um, issues, when you know that the person is alive. If the person is alive and is breathing, so it might be a good thing to use oxygen if it's available. All right. So, yeah. So there are different types of masks that you can use for the person, and then, take the person to the hospital. So I think that is, and make sure you hand over all this, make sure you hand over, write the reports, yeah, and everyone that will be there that experienced what happened, you make sure that you do a debriefing for all staff support, yeah. So there's many post cardiac arrest syndrome, yeah. So there are care things that you need to do after the person has regained consciousness. You know, there are many ways to support the person, support the family, support the family. So the infant as well, there are ways to take care of the person. The children's own are not very, it's not like the way they do adults. So when a child is not breathing, so you do in five initial breaths when you want to start CPR, then 15 compressions. Yeah. So two ventilations. So the compression for the children is not for a child is not like this. You do two fingers like this. That's what you, and it's 15. Yeah. Then you do 5 breaths again. So for a child is different, but um for what's it called, for an adult is also different. All right. So I mean, this is something I would take the training again, especially for basic life support. It's not something I can really tell because you need to see how it works. We go through it together and we'll be able to see it. Yeah. So apart from this, I would like to announce to you that we've actually come to the end of today's training. Yeah. Thank you very much. And I don't know, anyone have any question? Any question? No question. Are you sure? Okay, if there's no question, I think we cannot draw the curtain yet. And thank you. Have a lovely day. Please, the title on this thing, can we do it mandatory training? So you put the part 2, yeah, for this one. The part 1 is, we've already done the part 1. This is part 2. Thank you. Thank you.
Thank you very much, ma, for the lengthy class. Thank you for your time. God bless you.
Come, you are welcome.
Thank you so much, ma. In fact,
You're
the energy is top notch to talk at length. But we need to borrow from. We are grateful, ma.
All right. Thank you. Have a lovely evening. Thank you. Bye.